Welcome, everybody. I'm going to start. My name is Christine Apple, co-chair of the Milwaukee Mental Health Task Force, along with Mary Neubauer. Just to kick off the meeting, I'm going to start with the ground rules, and then Mary will start the meeting for us. Ground rules for Zoom meetings. Thank you for joining us, and please follow these rules. Everyone will be muted throughout the session. We hope to have time after each speaker for a few questions. Use the chat feature to type your questions. We'll answer as many as we can. Sign language interpreters are provided at this meeting. If you need assistance accessing the interpreter, please put your request in the chat. Speakers, please say your name before you speak to help with accessibility. Auto captioning is provided. You may turn captioning on or off. Click on the caret symbol next to the closed caption live transcript button on the bottom of your screen if you want to hide subtitles or to view the full transcript. At the top of your video screen, you can choose between speaker view or gallery view, whichever you prefer. Okay, I've introduced myself. Now I will leave it to Mary Neubauer to start the meeting.
Good afternoon. I'm Mary Neubauer, the other co-chair for the Mental Health Task Force. I'd like to welcome you today to our April 11th Mental Health Task Force meeting and remind you that you still have time to submit your comments for the state budget advocacy reminder and how to share your priorities for the state budget. And that'll be in the chat, and you can put your email comments into the link. And I'd like to thank Montreal Kane and Nicole Demaniano for speaking at the Joint Finance Comment Hearing on Wednesday on behalf of the Mental Health Task Force. And they did an excellent job, and they spent a fair amount of their time there, getting there early to get in line and waiting 3 or 4 hours just to make comments. So thank you very much. Please complete the Mental Health Task 2023 program survey. There's a link in the packet for that, and a reminder that you can still contribute to the Mental Health Task Force annual membership drive, and there's a membership drive letter, and it is through those contributions that the Mental Health Task Force functions and survives. And without those contributions, we cannot survive, and that pays for our support staff that is provided through Disability Rights Wisconsin primarily. And so that membership, the annual membership drive is very critical for our opportunity to exist. And the meeting materials are posted on the website, and the link is in the meeting materials. So that is the introduction for today's meeting. And now I'd like to turn it over back to Christine. Thank you.
Okay, and we've got an exciting meeting today. We're going to start the meeting first with talking about the DHHS opioid settlement update. And so we're lucky to have Steve Grodetsky, the Strategic Initiatives Director from Milwaukee County Department of Health and Human Services. Also Jen Whitwer, the Director of PARS at BHS, and also Mike Lappin. I didn't check to see if Mike Lappin was here, but hopefully he's here also. So without further ado, I think we were going to start. Oh, hi there. Good to see you. And I think without further ado, we're going to start with Steve. Thank you.
Good afternoon, everyone, and thanks for inviting us to speak about what the county is doing with its first set of funding of opioid settlement dollars. So we have a presentation that we'll go through. I'll be joined and presenting that by Jen Whitwer, the Director of Community Access to Recovery Services. So we'll kind of tag team the presentation, and we'll be open to questions kind of towards the end. And just to mention, the presentation is structured a bit with quite a bit of context up front, and then getting into the settlement funding itself and some of the early projects. So I want to share those expectations. All right, let's see how sharing works today. All right, hopefully the sharing is working. I'll just mention that this presentation we had shared at various public forums in the past. I think we'll speak about some kind of latest updates on it, but we did share this presentation also at the last mental health board meeting, as well as the county health equity, health needs and strategic plan committee. All right, so just in terms of agenda, we're going to spend just a bit of time on background, again, trying to set the stage on kind of why this issue is important, as well as recognizing that the department does quite a bit on substance use today. And we're going to talk about opioid settlement dollars and what we're doing with it, but recognizing it's another really nice and flexible funding source to address those needs, but a lot of work is already taking place. We're going to talk about a couple of reports and sets of recommendations that have taken place over the last, almost 5 years on this topic. So we'll talk about the City County Cocaine Opioid Heroin Task Force that started its work in 2018, made some recommendations, as well as the Wisconsin Policy Forum reports related to opioid settlement dollars that I believe was released at the end of last year, early this year. So we'll just kind of summarize some of those recommendations as context for the work that we are doing with opioid settlement. So then we'll hop into the process itself. We did some community engagement on this topic, and some of you who are here today participated. And then we'll talk about some of the projects and kind of the how they map to recommendations and a little bit of path ahead. So a lot to cover, but again, I think we have about 45 minutes, so we'll have some time for Q&A, and my guess is this is not the last time we're talking about this topic. Okay, so we're going to start with just a little bit of context setting on substance use. And again, Jen Whipper, I think you were going to cover this page and just highlighting what we're seeing from the medical examiner's data on substance use and drug-related deaths. So Jen, if you would mind hopping on and just kind of speaking about some of these high-level trends.
Sure. Thank you, Stephen. Good to see everybody again. So on this slide, we've really just broken down by year going back to 2017, the drug-related deaths that we're seeing in our community. And I would note that the data that we have for 2022 is probably close to completion, but maybe not quite yet. Often the toxicology through the medical examiner takes many weeks, sometimes up to months, depending on the backlog that they're experiencing. But as you can see over time, the total drug deaths in the green bar generally are going up. Again, with those 2022 numbers, probably not yet to completion. And what we've also seen over time is that those deaths that are related that include fentanyl, you'll hear a lot about fentanyl, and that's often combined with not only with opiates, but often with the opiate supply that's out there. So that's something that we've paid a lot of attention to. What we don't have on here yet, and or maybe there is a little bit on it, I guess there is slightly at the last dot there, is fentanyl and xylazine, and that's something else that we're starting to pay more attention to. It's xylazine, for those who aren't aware, is actually an animal tranquilizer that is making its way into drug supplies now. It is not able, if there's an overdose with xylazine, it cannot be reversed with Narcan. So it's extremely dangerous and has a lot of consequences. It's had a heavier presentation on the East Coast. We're concerned that it's starting to make its way toward our community. There have been noted deaths from xylazine in our community. So we're paying attention to that as well. But, all of the numbers are trending upwards, and there is a county dashboard as well that depicts both the fatal and non-fatal overdoses are what we're paying attention to, so that we can really be nimble and respond with all of the strategies that we're putting into place for harm reduction and intervention in the communities that are hit the hardest.
Yeah, thanks, Jen. Thanks for pointing out the data is probably incomplete for 22. My guess is that once it's complete, I don't think we're going to see this decrease that we're seeing in the data here. It likely is, flat or higher. And I'll see if I can drop a link in the chats for the dashboard you're referring to. And then the next page is just, I think, recognizing that the county has been doing work in substance use for a long time. We have 10 different funding sources, $14 million of funding in this space. So just want to recognize the work that we're doing there. Maybe Jen, you can highlight some of these.
Yeah, and I actually, Steve, you might not be aware of this. I presented to the Mental Health Task Force last month, and I was able to cover a lot of this in my presentation about CARS when we met last month. But really, obviously, we have a focus on helping people access the services that we need and that eligibility determination. A lot of investment and even more now with the opioid settlement around prevention and just adjacent to that harm reduction. We have several opportunities for care coordination in our system. On here, we've referenced our recovery support coordination, which is for individuals with substance use disorders. But of course, we also have CCS, and then there's care coordination for mental health. And then treatment, a lot of the treatment for SUD is covered by Medicaid now. And so we don't have as big of a role with that. Ooh, am I echoing? Or is that, oh, there we go. We don't have as big of a role treatment, although we do cover treatment for individuals who are uninsured. And we also have contracts for, you see there are sobering center and withdrawal management. That's what we would typically call detox. And then on the other end of the spectrum, for individuals who are further along on their recovery path, we have a lot of recovery support services. And with us not having to fund treatment as much now that the Medicaid waiver came through and is paying for residential treatment, we are able to reinvest and reallocate a lot of those resources that we have to support these recovery support initiatives, a lot of them being tied to social determinants of health. So that is a very exciting time for us to be able to really support those paths of recovery in a different way than maybe what we've done historically, but those are going to be all those things that are just as important, if not more so, than clinical treatment in helping somebody recover from their substance use disorder.
All right, thanks, Jen. It's probably always worth repeating kind of some of the current services. I appreciate that. So, this is a little bit of the context that, we're going to talk about some of the recommendations. We're going to focus on this new funding, and that's appropriate given its potential role, but it is all in context of a lot of the work that Jen's team is doing already in substance use. So thanks for that. So I'll cover a bit of context and do some process pieces, and we'll kind of we'll come back to Jen presenting later in the presentation. Thanks, Jen. We're going to cover a couple of efforts that have taken place over the last 5 years in making recommendations for further development of programs related to substance use that we've already acted on, and also that inform our future efforts. In 2018, the City County Heroin Opioid Cocaine Task Force was created. Again, it's a kind of collective impact body that has a number of representatives from the county, including our justice partners, housing and behavioral health, medical examiners, OEM, but also our city partners. And it's been co-chaired by our administrator, Mike Lappin, and Mike Murphy from the city. It intentionally had been selected to represent multiple sectors of the city, county, and state. And then very importantly, also those with lived experience. And really throughout 2018 to 19, the task force met regularly and built up to a set of recommendations. These were open meetings, there were regular community meetings, and open for community input. That then created a bunch of recommendations. Again, I think those came out in 18-19. And here is just some high-level recommendations. Again, this information is available in other sources as well. And again, I think a lot of these we've already acted on. So I'll just name them here. The first focus is reducing the number of opioid-related deaths in Milwaukee County. Again, pointing to harm reduction strategies in order to really focus in specifically on this issue that we've seen grow over time. And frankly, it has grown throughout COVID as well. Enhancing prevention programs. Again, think about how do we invest upstream. Ensuring adequate access to quality services for all people with substance use, kind of thinking about some of the special populations. Developing programs in collaboration with the criminal justice system, recognizing that sometimes individuals that have substance use needs end up in the criminal justice system, and how do we provide services there and think about enhancing those partnerships, enhancing collaboration between community-based initiatives and government agencies, again, kind of building the bridge between government and community-based programming, and improving epidemiology and surveillance, some of the data that we're sharing, and some dashboards that have been created is thinking about how do we use medical examiner data, OEM data to better understand what's going on in the community and the targets our interventions. And then finally, kind of an advocacy piece around supporting federal, state, and local priorities on legislation around substance use. So, as Jen was presenting, some of the current programming, a lot of those are, we're looking to reflect these recommendations that took place in 1819. So harm reduction, advocacy, and other elements. So that's just a bit of context. Again, the task force continues to exist. Maybe it doesn't meet as frequently. I know that we presented to the city county task force in February, so that standing body still exists. Just a little bit of context then on the Wisconsin Policy Forum report, which again the work took place in 22, and the report came out towards the end of 22. When DHHS, the behavioral health leaders, started receiving information about the opioids settlements, we approached the forum to assist us in creating such a report. So really working closely with them and developing that. But thinking about the substance use landscape throughout the county, certainly thinking about behavioral health and what we fund, but looking at landscape beyond this as well. And the purpose was to share that publicly and to share that with stakeholders and general public, and then provide some clarity about kind of what we should be thinking about when it comes to the settlement. A lot of interviews, a lot of data was shared with the team, and again that the forum report is public, and I believe the information that was shared with this group in the announcement for this meeting included those links. Maybe after the presentation, I'll drop those in the chat for folks' convenience. The report is really well stated, and it's kind of 30 pages long. So we pulled out some of the key recommendations in the summary, and obviously others can kind of read some more detail on that. So essentially, there are 5 broad recommendations. One is investing in residential treatment and housing, and this is thinking about how do we create more residential treatment beds and kind of other housing supports for individuals in need of treatments. Just recognizing that some of these residential treatment facilities are able to be funded by Medicaid, but there might be startup costs and other needs to expand the number of beds. So certainly think about that in our recommendations. Addressing funding flaws, I think just a recognition that the way the funding flows into the county, it comes in all these 10 different funding sources that are actually kind of specific about who they fund. And so what we found over time is that there's gaps in terms of individuals who need supports, but our funding sources don't fit those. So to the extent that the opioid settlement dollars are more flexible, we might be able to look at that. So one example, and we'll talk about that in the projects, is individuals who are incarcerated, do not have Medicaid enrollment at the time. So that's a funding flaw, and that we're thinking of, or we are addressing through some of the projects. Investing in behavioral health, the role as coordinating gatekeeper. This one is speaking a little bit about how, historically, county government was funding a lot of these residential treatment beds, and therefore kind of held a role in kind of wait lists, et cetera. Now that we are providing some funding, but a lot of the funding comes from Medicaid, we have a different role, and there's a question about kind of what, how those different treatment facilities should be coordinated in the future role of DHS. So that one we're still exploring. The next one, addressing other pressing service gaps. This one, a lot of the recommendations there are about workforce, and truly workforce is something that we're thinking about across human services and certainly behavioral health overall. So making a number of recommendations there. And then finally, just bolstering prevention and harm reduction, really in alignment with the city county task force spoke about. So these recommendations were an input into how we've been thinking about using the opioid dollars, and will continue to be kind of explored. So all of this there's a lot of context setting here for folks who maybe have been following this as closely. So I appreciate you listening through all this context setting to get to the main topic, which is opioid settlement. Maybe just before we talk about funding, one thing we also did was we held a couple of community conversations in February, which were really well attended. I think we had 75 or so participants over the 2 virtual conversations. Thank you to task force for spreading the word. A lot of the folks on this call participated and really were very fruitful in sharing the needs, and also give us some thoughts about how to work with community organizations on this topic. So more to come there. So finally, getting to opioid settlement. The background here is a bit from the county perspective, but broadly speaking, folks are aware that there have been a number of opioid-related lawsuits that were aimed at producers and distributors of opioids, and then there's 6 to 9 different entities involved in those lawsuits, and a number of settlements are coming through. They're coming through in waves. So what we're speaking about here is the first wave of settlement dollars. So the first wave involved a lot of distributors of opioids, and funding came through both to the states and to a variety of municipalities and counties. So the states are holding on to opioid dollars and has started distributing those in a variety of ways. Then the county received a first set of dollars at the end of 21, and we started working on, well, we received information in 21, but started receiving funding in 22. Essentially the first wave of settlements, the county after fees is receiving $56.6 million over the course of 18 years. So on average, that's $3 to $4 million a year, though the funding comes through kind of not as evenly as $3 to $4 million a year. We're going to talk about this funding. We're going to talk about the first settlements in terms of how we're using it. It's worth noting that the second wave of settlements has come through over the past couple of months, and those settlements involve CVS and Walmart and Walgreens. That dollar amount is about 45 million over the same time period. We're still receiving more information on that. Don't have more info there in terms of how the funding is coming through, exactly what we're doing with it. So the focus is this first set of settlement dollars, kind of the $3 to $4 million a year, but more to come on kind of more funding that comes through to the county. And truly, they're viewing these dollars as long-term dollars, that they're quite flexible, and we're thinking about how to use them strategically over the course of time, rather than thinking about these as one-time dollars. So that's a little bit of the context on opioid settlement dollars. Again, the counties receive these dollars. Some, I don't know, something like a dozen municipalities around Milwaukee County also receive some dollars, those smaller dollar amounts, and the states, of course, also has opioid settlement dollars that they're distributing. So the scope here is the county's dollars and the first settlement specifically. Just a little bit of context on how the county chose to pursue this. The county looked at these dollars countywide. So certainly behavioral health does substance use work, but really opened it up to all the departments of the county to participate. So our colleagues at the medical examiner's office, the Office of Emergency Management that works with fire departments and EMS, and also the sheriff's office participated in this work. Our central offices ran a process to collect proposals and then review those proposals and score them. They made recommendations to the county exec's office, and then went through the county board through kind of the first quarter of this year to make recommendations on these projects. And we'll talk about what these projects are. The way that the central office structured this work was around these 4 types of opioid opportunities. So one is around prevention promotion, the other one around harm reduction, next one around treatments, and then kind of other. And so that's similar to how Jen just spoke about some of our programs. So what you can see is quite a bit of our programs are in prevention promotion side, and harm reduction treatments. In elements of other strategies, those include work with our homeless population, work on analytics, and then a couple of projects from our medical examiner's office, recognizing that they have a role to play in recognizing, understanding the toxicology, and therefore, feeding into our prevention efforts. So this is the full breadth of the 15 projects that were selected for funding. These are three-year funded projects. And in the presentation that we shared and that was shared out ahead of this meeting, there's essentially a one-pager on each of these. And these 15 represent projects from across DHHS, but also medical examiner, OEM, and one project from the chair's office. So I'm going to turn over to this next page, and I'm going to ask Jen to speak through these. And what we are doing here is we're mapping the Wisconsin Policy Forum recommendations, the kind of 5 areas we spoke about at the top, to the Department of Health and Human Services projects. And maybe, Jen, you could speak a little bit about some of these projects, specifically on behavioral health side. I don't think we're going to go page by page for each of these, but we can certainly dive into specific projects as folks have questions. So Jen, maybe you can speak through these and kind of talk about the connection to Wisconsin Policy Forum recommendations, and then we'll entertain some questions.
Sure, yeah, and I'll probably mostly focus on those that pertain to behavioral health services, because that's what I'm most familiar with. But Steve, I really appreciate you putting this slide together that really maps out those high-level recommendations that had come through from the Policy Forum, and how some of the projects that we're doing directly tie to those. So first is investing in residential treatment and housing. And we, of course, do recognize that while it's wonderful that Medicaid is now paying for residential treatment, and Milwaukee County is able to support that by paying the room and board, in addition to the care and treatment that's paid for by Medicaid, that didn't solve all the problems. There still is not enough capacity. And so while historically Milwaukee County Behavioral Health Services in CARS, we were managing a wait list for residential capacity, now it's our vendors in the community who are managing those wait lists with each of their own facilities. And so we really wanted to make a commitment to increasing that treatment capacity and availability in our community. So that is one of the funded projects, and we are in the process right now of getting ready to release an RFI that will include opportunities for some funds, for whether it's to attract new vendors to our community or to help existing vendors expand their capacity. So anybody who's on the call who may be interested in that, or if you know anyone who might be interested in that, please keep an eye out for that RFI or RFP that will be coming out yet this year. In addition to that, I would just add that, the state of Wisconsin has funds as well, and they've been putting out RFPs for sometimes very similar activities to what we're doing, and I believe some awards have been made that will impact our community as well. So and we also had our own initiatives underway, so we're really hoping that in the next, I would say, 1 to 3 years, we can see a substantial increase in residential treatment capacity. So that's exciting. We also have housing listed on here, and although this isn't directly tied to the opioid settlement, I would just mention that, as I mentioned earlier, we're able to focus on social determinants of health with a lot of the funding that we have that we're not now spending on residential treatment. And we have increased our bridge housing, or that's really safe, sober housing for people to live in while they're still in treatment and on that, commencing that path of recovery. So we've been able to do some increases on that front as well recently. So that is great. Next up, we have addressing the funding flaws. Steve had referenced this earlier. This was actually a project that I was very hopeful would be funded with the opioid settlement funds. So about 3 years ago, with support from the Bureau of Justice Assistance, we had a grant that helped us get a project started that we called MAT Behind the Walls, MAT standing for Medication Assisted Treatment. And what that allowed us to do was to work in collaboration with WellPath, who's the healthcare provider in our Milwaukee County Jail, and more notably the Community Reintegration Center formerly known as the House of Correction. And we were able to work with them to identify individuals who, upon coming to one of those facilities, was living with an opioid use disorder, and talk to them about the opportunity of enrolling in medication-assisted treatment and the counseling supports that go with that. We started with Vivitrol, but since that time, or over the life of the grant, we were able to also add Suboxone and Methadone. So all three options for medication-assisted treatment are now offered in the House of Correction, or excuse me, Community Reintegration Center. I'm still adjusting to that. And so people are able to start this treatment before they leave the facility and get connected to community medical services. That was the other partnership that was part of this. Make those connections while they are still in the facility and continue those relationships after they leave. We know this is saving lives, and it's been growing in popularity with the population there. And the funding flaw was that we are not able to use our federal funds for individuals who are incarcerated. This is where the opioid settlement funds and the flexibility that they offer was really a wonderful thing. And so to be able to continue to fund this after the grant had ended was very important to us. And it really started primarily with the Community Reintegration Center, but working to bring that jail population into this and fold them into that as well. So we're now entering into a contract with WellPath, who will subcontract with Community Medical Services to continue that important project seamlessly. We don't have anything yet under investing in BHS's role as a coordinator and gatekeeper for services. We're still taking that under advisement and consideration and trying to figure out what that means for us as a system. So stay tuned on that front. And then other pressing service gaps, that was more so with CYFS and housing services. And again, I just think this really highlights, I really appreciated that all of the departments at Milwaukee County had the opportunity to apply for funding with the settlement funds because the opioid epidemic touches all the populations that we're serving in Milwaukee County and especially throughout DHHS. So some of those departments had their own initiatives that they'll be getting up and running in the next year as well. And then we have bolstering prevention and harm reduction. Of course, we have a longstanding commitment to prevention and harm reduction out of our department, but to be able to spread that a little further throughout DHHS and make some bigger investments is really an exciting opportunity for us as well. I know that Jeremy Triblett had attended a meeting, I think it was 2 meetings ago, to talk about the vending machines. Obviously, that's something that has attracted a lot of attention and it's gotten media attention. Our first one has been placed at the COG Center. It is getting used. Oops, you lost me there. We had about, I think we just closed the applications we have 27 vending machines to deploy in the next 3 years. We had over 30 applications. We're taking a look at those now, really trying to match those to the communities that have been the hardest hit, because we have about 11 machines that we want to deploy in the next year or so. So information will be forthcoming, and we will get media out there. We want to have QR codes with maps so that everybody knows where they can access the supplies once we are able to deploy those vending machines. We will have a contract with Vivint, who will really be taking the lead on making sure that those vending machines are supplied at all times, that they're working with the host agencies or organizations that have those, and keeping that process flowing. And then as far as coordination of opioid prevention services, obviously at BHS and CARS, we've had prevention services that, quite honestly, we've been required by our funding to have for as long as we've had the block grant funding. We've always invested more than what has been required of us. So we've had that commitment there. We understand that there's a science to prevention. We believe in it very much. Our other departments who have been in DHHS who have been impacted by this opioid epidemic haven't had that same experience with prevention. So there is a position that has been created called a prevention integration manager that will really work to bring all of the DHHS departments together so that we can have a unified science-based approach to prevention throughout all of the departments. That position, Shakita LeGrant-McLean and I just completed our first round of interviews today, as a matter of fact. And so I would expect that we'll make an announcement on that position relatively soon. And that individual will be able to get to work to sort of synthesize all of the work that's going on in our department.
Jen, I was just, thanks for walking through this. I was just going to add, some of the dollars in the coordination of opioid prevention services will end up having a regranting process for.
Oh, yes, thank you.
So maybe you can speak about that. Yeah.
Yes, thank you for reminding me. That's so important. So under this project, this coordination of opioid prevention services, so the position that I just spoke about, in addition to that, and really based off of the really rich feedback that we got in our community listening sessions, we are developing a community regranting process. So, Shakita has mentioned so many times the importance for DHHS to get these funds out to the community. That's not just about funding, our own departments. And so we want to work with partners who have, maybe they have things that they're doing that they have been doing and they know work, and they have funding gaps. That may be one opportunity. There may also be innovation, that we want to try new things or introduce things that haven't been introduced in our community yet. So we are working on a timeline for that. We definitely want to get this out the door. I think we're in April now, and I think by May, we want to have the application process announced, and then we'll have a review panel and a scoring and all of that with announcements in June or July. And we are really hopeful that as more funds come into Milwaukee County through additional settlements, that we will be able to make further investments in those community partnerships. This is really just the first round that we'll be announcing soon, hoping that we can do more of that later.
Yeah, thanks a lot, Jen. Yeah, I really like, just wanted to highlight there's, essentially, two of the projects on this page have a regranting component, and just, recognizing that, the work that needs to happen in the community, not just done by county government, but by a lot of our partners. So we want to support our partners, through these projects. So, this regranting opportunity on prevention, and then also the residential substance use treatment capacity, both going to be RFIs and RFPs kind of related to getting dollars into community providers. And then, Jen didn't really speak about numbers 2, 9, and 10, but just recognizing the intersection of our aging disabilities area with opioids, and that team put together a project focused on getting the word out with that population, and a population that we're seeing increasing need in substance use. Our youth justice area, thinking about providing more supports for those in our care in this topic, and then finally supporting our homeless outreach teams on this topic. We know that there's a lot of intersection of substance use with that population, and supporting the work there. So
Steve, I just wanted to add one more thing that's more of in the future, but was part of one of these first proposals around the harm reduction supplies. Obviously, there's a bandwidth issue. We're really working on deploying the vending machines right now. Vivint is, as I mentioned, is the partner who will be helping us with that. The second phase of that project, which will probably be next year, just because of bandwidth, is Vivint has plans to create a website so that people can directly order supplies. And so we'll share more information with the mental health task force as we get closer to that initiative. But again, anything we can do to make the supplies widely available, that people can get them as discreetly as they need to, that they can have them in their household. That's the objective that we're working towards with all of our harm reduction supplies.
Yeah, thanks so much. So at this point, I'll stop sharing, and we'll entertain any questions on this topic, and I'll a lot of information to digest here. Barbara, I see your hand, your virtual hand raised.
Thank you. Well, thank you for the overview and a lot of really encouraging information about new services. I wondered if, as part of that, you could talk with us about the communication strategy to increase awareness, and maybe that's something that the mental health task force or some of the agencies at the table are able to help with, you know, because so often services may be available, but people aren't aware or they have barriers to navigating them.
Yeah, I will say, Barbara, thank you for that. And we will turn to, you know, partners like the Mental Health Task Force for that. We recognize that with everything that we're doing, and especially, you know, with the prevention campaigns that we have, but the harm reduction dissemination, even when it comes out to putting out the RFIs, like that communication piece is essential. For a lot of the work that we're doing, we will have a component that will be media campaigns that will be part of that. We had a really successful campaign that we were able to do with a different fund source, but our Better Ways to Cope campaign that did include regranting. We are going to renew that as well. And just from a branding perspective, we may, for prevention and harm reduction, build on that Better Ways to Cope campaign and website that we have in place. But yes, the communication is essential. I see Mike Lapham popped on the screen. He told me, isn't that what we call it, to be part of an exciting project with a healthcare partnership around navigation of both mental health and substance use disorder services, recognizing that while we do have some gaps in our system, we also have a lot of services that are out there, but people just don't know the best way to access them. And so there's a group of us, a small group of us, who are really committed to addressing that and helping with those navigation gaps that we have in our community. So that has nothing to do with the opioid regranting, but it's work that is happening concurrently, just to make this group aware of that.
Thank you both. This is the time, folks. If you have questions, feel free to put them in the chat or to speak up.
Denise Johnson has posted something in the chat. I know that she and Jeremy had connected once previously. So Jen, do you know if some of those items are available in ASL yet? And if we have plans to make those available?
That I don't know, although I know there was feedback in our community listening sessions about ASL and other language needs. And so that is something that we're exploring and figuring out the best way to do that. So that definitely, when that information was shared, we are taking that in and planning what we can do to meet those needs. Because it's not just about language, sometimes it's about literacy. So we're really trying to think through what are all the different avenues we can explore to meet those needs, so everybody knows where everything, the services, the harm reduction supplies, et cetera, are, and how to access them and how to use them.
Just one more question that I put in the chat, wondering if you can share when the RFIs will be released for the different opportunities. So
I don't know that. I know that for the re-granting process that we spoke about for getting money out to the community who may have existing funding gaps or innovations that they'd like to introduce, that's probably on the most aggressive timeline, and hoping that that application will be out by May at the latest. And part of the feedback that we got in our community listening sessions, by the way, was that we need to give applicants adequate time, of course, but also from an equity standpoint, that we want to help those organizations that maybe aren't as experienced or haven't had a contract with Milwaukee County in the past, to get the support that they need to put in an application that could be given consideration. So we want to be aggressive with our timeline, because we are eager to get the money out there, but we also want to make it so that the application process is fair and reasonable to everybody who might be interested. So that's probably what will be coming out first. The next thing that I'm aware of that we'll be pushing out would likely be that residential capacity building, and that process is underway. In addition to what we have going on with the opioid settlement, there are just a lot of other initiatives that are going out for bids. Some of them, it's just routine business, the things that we put out every 3 to 4 years. So we have recovery support coordination out right now. Soon we'll have the access points. So that's business as usual. We have our peer specialist academy that we're trying to put out. We need to build care coordination agency capacity in CCS, as well as some ancillary capacity. So there are a lot of competing needs and only one contracting department. So we are really trying to help them strategize what order do we put things out in to meet the greatest need. And they are struggling with the same bandwidth issues as a lot of us are. So, but we'll send those announcements through. And I always encourage anybody who thinks they might be interested in any opportunity, get signed up on Bonfire. That is the best way. Once you are signed up, you can get notifications of every opportunity that Milwaukee County puts out there that might be open for competitive bid.
Yeah, thank you, Jen, and good to hear about the plan to provide support to ensure that, you know, smaller agencies that may
that was
intimidated by this daunting process.
It's very intimidating, and that I have to give credit to Jeremy Triblett. That was something as part of the Better Ways to Cope campaign that we did, which again we'll be repeating this year. That will be another opportunity for organizations to apply for funding that focuses on prevention. But Jeremy had, as part of that campaign, had built in training opportunities that vacillated between training organizations about the science of prevention, but then also organizational capacity building. And that was a series that went on for several months for anyone who had applied for funding, whether they were awarded or not. And it was the best example I ever saw so far of someone working to create equity amongst those community-based organizations, because there's a lot of great work going on, but not every organization necessarily has the capacity to scale all the hurdles of a Milwaukee County contract. And so like, for instance, with Better Ways to Cope, we used a fiscal agent for that. So there was still an application process, but it perhaps wasn't as daunting. And we did bring in organizations who didn't have a history working with us, and they did some incredible work. So kudos to Jeremy with lots of support from VHS and DHHS to make those opportunities happen.
Well, thank you so much. It's been a really rich discussion and a lot of great information. I think, Mary, are you going to take it from here? Thank you very much, Steve and Jen and Mike, for all the great information, and everything is available on our website as well. So you can check out both the PowerPoint as well as the links that Steve had shared with us. So
thanks for having us.
See you all soon.
Thank you, everyone. Okay, is Mariah available?
Hi, good afternoon, everybody. So excited to be here. And very
Wait,
excited.
hold on a second, Mariah.
Oh,
One
sure,
second.
yep.
Okay, what I'd like to say is this is our Alcohol Awareness Month, and what you can do. And so, yes, Mariah, yes, you're up, Mariah. Sorry. You're
Thank
up,
you,
Mariah.
Mary. Good afternoon, everybody. I'm very excited to be here today. My name is Mariah Iverson. I'm a member of the Mental Health Task Force Steering Committee. I am the Chief Operating Officer at Maida House, and it is my pleasure to introduce Maureen Busalacchi. She is currently the director of the Wisconsin Alcohol Policy Project at the Comprehensive Injury Center at the Medical College of Wisconsin. I have had the privilege to work with Maureen in different capacities at the medical college, and so really excited to bring her here today to talk to us about alcohol, about the things that she's doing with the Alcohol Policy Project. Maureen has pretty extensive experience in policy advocacy, starting with the Wisconsin Association for Perinatal Care and the Wisconsin Medical Society. She then moved on to become become the executive director of Health First Wisconsin and did some significant work with the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin before stepping into her current role. Maureen is a service-minded leader. She has chaired the ad hoc work group on alcohol prevention for the State Council on Alcohol and Other Drug Abuse, and has advised Healthy Leadership Institute of Wisconsin, the Wisconsin Initiative to Promote Healthy Lifestyles, and also acts as a mentor for the Wisconsin Women's Policy Institute. She is a frequent presenter at state and national conferences on advocacy, systems change, and public health issues. Welcome, Maureen. Thank you for being with us today.
Wow, thank you so much for such a nice introduction. One of the other pieces before I did Health First is I ran Smoke Free Wisconsin and worked to lead the campaign about reducing secondhand smoke exposure with smoke-free air campaigns, raising the tobacco tax, among other things. So thank you so much, Moira. It's great to see you. So I'm gonna share my screen here today, and we'll go ahead and get started. And I think you're seeing the correct screen. Excellent. It's always a question, right? When you're presenting. So happy to be here today. I also just want you to know, in terms of my style, I'm happy to take questions during the presentation, so you don't forget as we go along here. So today we're going to talk about the State Council on Alcohol and Other Drug Abuse report. I'm first going to lay out why we did this report and why Wisconsin has an excessive alcohol use problem. We can talk about the report and talk about resources in terms of understanding the materials and recommendations as we go forward. But I'm going to step into what the problem is. And so it is April, it is Alcohol Awareness Month. And so we've been working, doing kind of a social media campaign. So you can follow us on Facebook, Twitter, or Instagram. WISAP is our acronym, WISAPP, and see kind of what's happening. We have a big problem in Wisconsin. And I know you were just talking about opioids, and that's also a significant issue. But in Wisconsin in 2022, just over 3,200 people died from alcohol-related injury, accident, trauma, and disease. So this shows you how much is happening on our roadways in terms of being injured or killed in Wisconsin. So that means that we have 8 to 9 people dying every day because of excessive alcohol use. And when I talk about excessive alcohol use, I'm talking about binge drinking, which is 4 to 5 drinks in a single setting, heavy drinking, which is 1 to 2 drinks every single day, use by people under the age of 21, and alcohol use by those who are pregnant. The cost of excessive alcohol use is pretty high, and I'm going to go over a couple of pieces by that and tell you more about the burden, but it's generally estimated at $6 billion. And much of that, we could be deploying in other areas, especially, I heard DHHS talking about the need for better mental health systems. If we could shave this problem down a little bit, I think we could be making a more positive impact in Wisconsin. So just outlining the emergency room visits from those with chronic. Now, this is just chronic alcohol use. This is not the injuries that happen, which tend to happen to those who are younger. That this is folks who have a chronic use of alcohol. And we're seeing the ages go down. There are women who are now getting liver transplants in their 30s. So that never used to happen. It was always, 50s or 60s. So it's really changed, and it's creating a big burden on our health systems. And then I knew you were going to talk about opioids, and that's always an issue. So if people are binge drinking, and in Wisconsin, the average binge drink is 8 to 9. Remember I said 4 to 5? In a 2-hour period means that you get to the intoxication by your blood alcohol level. So almost double that. And folks who do that, especially if they're young, are much more likely to be using other substances. And so this is an issue I think that we both share in terms of, wanting to make sure people are healthy. I find this statistic really amazing that a lot of the folks, or most of the folks who are excessive alcohol drinkers, are not alcohol dependent. So in the population, about 64% of people drink alcohol. About 10% have a clinical diagnosis of an alcohol use disorder. So that leaves about 90% of people who drink alcohol with, and I sometimes say not yet an alcohol use disorder, because some people might be heading that way. And there's a large population that does drink very little as well. So I think it's important to understand that we're dealing both with people who have an alcohol use disorder, but also the environment that encourages people to use alcohol excessively. And there are things that we can do about that. And some of those things come from the charge from the SCAOTA, the State Council on Alcohol and Other Drug Abuse. So they charged this ad hoc work group that I led on a number of things. I'm not going to read through those strategies, but we really tried to look at that. This report is in some ways updating a report on alcohol culture and environment from 10 years ago, but also looking, there's been so much new research coming out that, we thought it was time to look at it and make new recommendations. So just really quickly, the process was that we got the charge in 2020, the prevention committee worked on it, SCAOTA approved the work group. The work group worked with a number of experts, and we also had hearings. And so we had experts come in and, give us recommendations. We also invited the alcohol industry, to speak as well. And so we heard from some of their folks. And so then work groups worked on the recommendation. The prevention committee approved the recommendation. And then the SCAOTA finally approved the final report. So that took a while. So the building block, like I said, was this 2010 ACE report. And that was the first time we had a roadmap in Wisconsin about how to reduce excessive alcohol use. The challenge is making it happen, right? It's, you can always do a report, but it's the implementation that is the hard part. And a lot of good things have happened since 2010, but there's a lot of counter things that are happening in the alcohol environment. So we haven't seen those numbers shift at this point, but we have seen reductions in underage drinking, but we're still above the national average. So what's new in this report, just to give you kind of an overview, we're looking more at the monitoring and evaluation. So understanding what people are doing, understanding how they are, when and where they're using alcohol. We're definitely looking at health equity, looking at ways to improve patient screenings, because it's often helpful, and you've probably heard this about other things as well, when a healthcare provider talks to you. So it's not just necessarily the primary care physician, but it can be ER docs, it can be a pharmacist, and others that can provide sort of context about, your drinking's kind of out of line. And, it could bring some real issues. I'm going to pause and tell you a story. We met with the liver transplant team here at the Medical College of Wisconsin, and they were saying there's definitely a need to make sure people understand about alcohol use and kind of appropriate use, if there is such a thing, because they had a family come in and there's somebody who's super sick, with late stage liver disease, and they're talking to the family, and the family says that they all drink like a six pack before dinner. So you've already got a binge drink going on a regular basis. And they were wondering why they all didn't have liver disease. And in some ways, it probably just hasn't been detected yet. But this one person in the family, was really suffering. So hopefully that helped, family members get some help and support, because this, as you well know, is not easy to do, to, reduce or quit your alcohol use. But people aren't aware that that's not normal, and it's certainly not normal in the rest of the country. In Wisconsin, we are the only state in the country that has every single county above the national average for excessive alcohol use. The national average is 17.6%, and we hover around 24, 25%. And some counties are even up to 31. I've seen the city of Milwaukee binge drinking numbers are even higher than that. So we definitely have some work to do. So we also tried to provide more context so that folks understood why we put these recommendations forward, shifting to primary prevention. So you'll find that we don't comment on impaired driving laws or that kind of thing, because we would really like to start upstream, right, before the problem gets going. And we also think it's important not to be punitive, but to really look at prevention measures and screening as a way of working with people. And there's a lot of recommendations for employers, so those were covered in a different work group. And then, of course, we did invite the alcohol industry. They didn't participate very much, but that's that story. So who can do these things? There's a lot of different agencies that can. And I want to spend a little bit of time on this first box because civic, community, education, and religious organizations really often set a community norm for what is normal alcohol use. And so thinking with your own organizations, do you have fundraisers at breweries? Is the focus of some of the events around alcohol? It's easy to get mixed up in that. And I urge you to, like we always think it's important to clean up your own backyard before we tell other people what to do. So we really encourage you to think about what your own organizations are doing, and consider that maybe you want to kind of step that down in terms of promoting alcohol use. I know some places, when they're doing fundraisers, they'll give out drink tickets. Well, maybe give out one instead of two, to keep people kind of at that lower alcohol use limit. So I think there's a number of things that people can do to really send a signal that, we can do things without alcohol. And it certainly is it's a big issue, I'm certain, with the communities that you are working with. Healthcare systems and providers, there's a number of recommendations in there. And I do want to point out in these areas, we don't need legislation. We don't need an ordinance. We don't need a statute. These are all things that are really within our power to make change. So making sure in healthcare systems that patients are being screened. So there's some primary care organizations that are really working on that right now, so that they're screening people in primary care about their alcohol use and being able to have some of those conversations. There's a number of recommendations for local governments. And when I say that, I mean, well, counties for one, but they do not issue alcohol licenses. But your municipalities and tribes, cities, towns, and villages do issue alcohol licenses. And in Wisconsin, there's 1,951 that have licensing capability. So there's a lot of folks out there giving out licenses, and really we need to think more carefully about how much we want to have alcohol out there. So I think that's an important piece to keep in mind. State government and state agencies definitely have a role, as well as the alcohol industry. If there were a silver bullet, I would be so happy, but there's not. You know, and I also want to say that when you look at this, it can be overwhelming, right? There's so many different aspects to alcohol in our culture. And so it's easy to also feel overwhelmed. But I think, we can work towards a comprehensive approach, but any piece you're moving forward in your communities or in your organizations is going to be a step forward. So modifying the drinking environment, thinking about festivals. There'll be a lot of festivals coming up this spring and summer. Do they check for IDs? Do they have a badge, or a wristband, not a badge? Are the folks who are serving alcohol at these events, do they understand what it looks like if somebody is intoxicated? Because it's illegal to serve someone who's intoxicated. So just thinking about calming some of those events down a little bit. Of course, increasing the cost is an issue. The promotion of alcohol to youth, there's a lot going on with the alcohol industry and getting in social media and speaking to our youth. But there are things that local municipalities can do with overall advertising. And so we can kind of reduce how much is being promoted to our kids. We also, of course, need the positive messaging about being able to do things without alcohol. Availability of alcohol, looking at sales hours, how many places can you buy it? We just worked with some students at UW-Milwaukee who are in the planning department and found in a 20-minute walk to one high school in Milwaukee, there were 91 either advertisements or alcohol outlets on the way. So it sure, I don't know that that's what the city planned to do, but that's what's happened. And so thinking about maybe we should take a step back on some of those things and re-look at how many places we have that sell and serve alcohol. Of course, we want evidence-based alcohol education. There are things floating around there that are not evidence-based, and sometimes they work against us. So it's really important to make sure that the education that we're giving is powerful and that is based in evidence. More engagement with preventative health care. Clearly, there are definitely laws and regulations that we recommend. Excuse me. That can help reduce excessive alcohol use. For example, one of them is accessible right now, but not many cities are able or municipalities are able to do it. It's alcohol age compliance checks, making sure our retailers aren't selling to kids. And, the public is informed and license holders are informed before they go out with decoys and have kids attempt to buy alcohol. They use their own ID or they don't have an ID. So, and again, they're informed ahead of time. So it's not a gotcha. It's like, are you selling to kids? And unfortunately, when communities we've worked with start doing alcohol age compliance checks, they find almost 75% sell to kids. So I don't think the city of Milwaukee or many areas in the county are able to pull those off right now, but that's certainly something that we would like to see, because that creates a lot of access and availability of alcohol to our kids. And of course, we need to monitor and evaluate all of this work. So we also looked at some top tier recommendations. So the density of alcohol outlets has been linked to a number of things, including child neglect, more violence. We find that homicides, often alcohol is fuel to that fire. And, about 50% of the time, alcohol is on board with somebody involved in that. We're also encouraging place of last drink data collection. So we want to understand, there's a lot of good bars and restaurants in the Milwaukee area and around the state that do abide by the law and are careful. And so we're glad that they are doing that. There are some other places, however, that tend to overserve. So that might be festivals, it might be some licensed establishments, but we find that it's also with recreational areas and other places. So we're encouraging work with law enforcement to collect that, because they already ask these questions when they pull someone over for an OWI, operating while intoxicated. And we want to try to understand where those places are, so that then there can be some education and bring those licensees, if it happens to be, or recreational or festivals, into compliance, so they're not over-serving their customers. I already talked about alcohol age compliance checks. I'm sure some of you are familiar with SBIR or SBIRT, the screenings and brief interventions, and then referral to treatment. Those can be very helpful with services, and we want to see that everywhere. So there are places where this is part of the court system, this is part of schools, this is part of healthcare systems. And so then we can help and understand where people are at. And then, like I said, raising the price of alcohol. So we hope you look at these recommendations and you can see what might be applicable to you and understand what are ways to create safer alcohol environments. So on the next slide, I've got some ideas. So I think first of all is building awareness about this. And so I'm going to pop in a site into the chat that shows you the Alliance for Wisconsin Youth and the alcohol awareness. So the slides I showed in the beginning of the presentation for social media and such can be used and put out there. So making sure people are aware about this issue, because I think a lot of people aren't aware of how devastating alcohol is in our communities. Be part of a coalition. I think you already are probably, but that's one piece of it. And then we also have a listserv. So if you're interested in joining our listserv, please feel free to email me. And we'll keep you up to date with research and trends, and then also opportunities for trainings. We want to engage with public health, with human services, with law enforcement. So there's lots of folks that are worried about this. I also know that in the community health assessments that are done and in Milwaukee County, alcohol came up as one of the biggest issues. And so there's definitely a need to address those, both with public health and the health systems and hospitals. So hopefully we can, as we embark on making improvements, we can work to work on alcohol policy. And following your license and review commissions, every month around the state, there are reviews of alcohol licenses, and as new businesses come forward and that kind of thing. And there definitely are conditions that can be put on, or licenses can be denied. A lot of communities don't realize they do not have to accept an alcohol license if they don't want to. And so there's things that can be done with those commissions, and just making sure they understand their own power is step one, which we're happy to engage with if you find folks who would like to hear from us. And so there's, my last slide. I'll stop sharing and I'm going to pop another website into your chat for the SCAOTA report itself. And I'm happy to take questions. Don't tell me you don't have any questions.
This is Barbara Beckert, Maureen. Thank you so much for all the information you shared. I mean, it was really an eye opener for me, and I guess really just a reinforcement about how much alcohol use and abuse is a part of the culture in Wisconsin. I just wondered, I'm not from Wisconsin originally, so I just wondered how did we get here? I know that's maybe an academic question, but sometimes understanding the history helps you know how to change things.
I think that's a great question. And we've been working on building kind of a timeline of that. And so that's still a work in progress. But what we've seen in the last 20 years is really a change in Wisconsin, where there's been kind of loosening of restrictions. So in some states, they have what you call alcohol control boards, or ABCs. And so they restrict the number of licenses that can be had by folks. So for example, I'll give you New Jersey, just because I know it off the top of my head. They allow one license per 3,000 people. In Wisconsin, we average about one per 500 people, but we have communities that have one for 250 people. So the density that we have is just massive compared to much of the rest of the country. And so that's a piece of that. And that's done both by local control as well as by the state legislature allowing more licensees, in part. There's a cap on Class B licenses, which are typically your restaurants and bars. We call those on-premise. But there is not a cap on off-premise. Convenience stores, gas stations, grocery stores, that kind of thing where you take the alcohol and you drink it somewhere else. We're also finding, especially in bigger cities, that there's a lot of violence that happens around some of those locations, the Class A. And we're also finding that there's a binge drink in a can. So they have these, 16 or 24 ounce cans, and there's 4 to 5 servings of alcohol. So like White Claw boasts about having 2, but Four Loko is happy to have 4. So and you have much less liquid, like water or whatever else is in that, and so you have a much more potent drink where people get alcohol very quickly. I see a question in the chat about non-alcoholic beer is gaining interest. And that's a great question. There's more research that needs to be done on not only non-alcoholic beer, but spirits and wine. And those are becoming much more popular. What we have learned is that those who are in the middle of trying to recover and not drink anything, that those beverages seem to be counterproductive. But it seems okay for others potentially to use. So it's kind of one of those things we have to be careful about and understand where people are at and the audience that you're serving.
Well, thank you very much to Maureen Busalacchi. And it's kind of shocking how Wisconsin is a leader in this type of area. But thanks for your information and all your efforts to try to reverse the course of what's been happening to our state all these years. And I am interested in that, how we
Barbara,
got here.
yeah, this is Susan. Maureen, I know you from tobacco control world. I just wanted to say, talking about culture, we moved here in 91 from Ohio, and I was shocked at how mainstream charities were allowing alcohol at their fundraising events. And we definitely noticed it, and it seems like it goes way back. Maybe to the beer days when, you know, we were beer production, a big beer production capital.
Yes, that definitely has. I know we're out of time now, but that definitely has. There are actually old postcards we have from Milwaukee about how to come here and get drunk and have a good time. You know, so it has been, you know, part of the culture for a long time, but I think there's a lot of restrictions that have changed in more recent decades. So thanks so much for having me. I really appreciate it.
Thank you very much again. Now, without further ado, I'm very excited to see Cheryl, Isabell, I have to say. Now we're going to be preparing for the unwinding of the public health emergency and why it matters. We have here Cheryl Isabell from the Milwaukee Community Engagement Lead covering Wisconsin. So without further ado,
There, I just had to unmute myself. Thank you so much for having me today. Just want to make sure that everybody can see my slides. I can't see you, so you'll just have to let me know if you're able to see the slides right now, the first slide.
Cheryl, this is Barbara. Great to have you here. It looks like the slides are we're seeing them in presenter view. So they're a little bit small. Is there a way to put it in slideshow view for us?
Let me go back here and see.
Thank you so much.
I don't think, is it really fuzzy? I don't think I'm able to.
It's just very small because we're seeing, you know, the slide and the next slide at the same time. It looked like there was an option to hide presenter view wherever you just were, maybe on those three dots, if you want to try that. I don't know if that.
I think it's under display settings.
Thank you.
Okay. So we want to hide presenter view.
If you, in the middle, at the top, it says display settings. If you can click that and see what, there's a small arrow next to it, see what options it gives you.
Let me just see what I get here.
So swap, I think the very first one. Swap preventer view and slideshow. Yep, I think that's what you want. Perfect.
Is that better? Awesome. Well, thank you. Thank you for your patience and thank you for your assistance there. I first of all wanted to thank you, Barb, and the Mental Health Task Force for inviting me back to speak with this group again. And today, we just want to talk again about what is going on nationwide, specifically here in Wisconsin with the Medicaid unwinding process. And again, I'm Cheryl Isabell, the Milwaukee Community Engagement Lead for Covering Wisconsin. On today's agenda, we're just going to have a refresher about Covering Wisconsin for those of you that are not familiar with our organization or, you know, just not haven't had a presentation from Covering Wisconsin before, and we're going to talk about what to know about Badger Care and Medicaid changes, the referral support that you guys can offer community members as well as Covering Wisconsin, and how to spread the word and the free resources and questions you might have. A little bit about Covering Wisconsin. We are a nonprofit agency within the University of Wisconsin-Madison Extension's Health and Wellbeing Program now. And what we offer is health insurance through our navigators, as well as educational outreach and promotions materials for our partners and other community-based organizations that want to help keep people covered in health insurance coverage. Again, just talking about our navigators, we do have health insurance navigators that are licensed, certified both federally and state to help people navigate the insurance coverage process, whether that is state health insurance coverage, the Badger Care Plus, healthcare.gov, through the marketplace, and other insurance options that are out there for people that are underserved, underinsured, or just need help and assistance in knowing how to navigate that entire process. And our navigators, they help people know their options and how to use their plan, basically overall just how to maximize usage of the coverages that they have. We service all 72 counties in the state of Wisconsin. So we have 28 navigator agencies located across the state. So anyone that is looking for assistance, needs insurance, has questions, can access a navigator throughout the state of Wisconsin. What our navigators do and what type of assisters that are out there to help clients and consumers navigate the insurances that they have. We have navigators, again, and certified application counselors that you might find in your community health centers or federally qualified health centers, agents and brokers. These are all folks out there that can help provide free services to consumers that are in need of health insurance coverage. Now, what to know about Badger Care and Medicaid. As you know, many of the clients that you serve and many people throughout the state of Wisconsin, specifically in Milwaukee County, have access to either Badger Care Plus or healthcare.gov marketplace insurance. The healthcare.gov marketplace insurance usually has a special enrollment period that begins around November 1st, and it will go through January 15th of the next year. Badger Care Plus is open for enrollment all throughout the year. And what you know or probably don't know is this year is they have the Badger Care Plus has a low cost or free comprehensive health insurance based on household size and income. And those are adults, men and women, whole families, pregnant women, and children. And again, they can sign up at any time. And throughout the Unwind, and we're going to get a little bit more into that, dive deeper into it. There are some special rules that have happened since the public health emergency was issued back in March of 2020, where many people were eligible for Medicaid insurance coverages, and they were not required to renew annually as the program is normally. But today, we are going through what is called an unwind because that public health emergency has ended as of April 1st. The official date will be May 11th of 2023, but folks are out there getting letters already notifying them of their coverage renewal dates. So what is the unwinding that everybody is talking about, that many of our clients are going to have to go through here over the next 12 months, actually June of 2023 through May of 2024. And it is the process of moving from a continuous eligibility to pre-pandemic back now to routine renewals. So Wisconsin's unwinding goals are going to include the implement of successful return to routine operations, such as renewals and redeterminations. They're going to help Wisconsinites stay covered. That is the main goal. We don't want anybody to lose their coverages because they didn't renew in time or they didn't know how to receive those notifications of their renewal dates. The goal is that no one slips through the cracks, no matter what their circumstances are, and that they can maintain health insurance either through an employer base, because many people's circumstances have changed over these last 3 years. Some people are now employed and they have employer-based insurance, but they chose not to enroll in those plans because they were still covered through Badger Care Plus. Or if they're no longer eligible for Medicaid and the employer-based coverages are too high, and we'll speak a little bit more about that, they have the option to enroll in a healthcare.gov marketplace plan. So the Badger Care and Medicaid changes. The renewal deadlines are spread again over that 12-month period that I spoke of a little bit earlier, June 30th of this year through May 31st of 2024. And people can find out their current renewal dates by creating an account on access.gov or through the app on My Access Now. What we don't want people to do is, which is why I'm happy that you guys are allowing me to have this conversation with you today, is we don't want them to renew too early. So for instance, if a person receives their letter, and those letters have gone out, so you all know they began to go out mid-March, with the last batch going out this past Friday, but we don't want them to renew too early. So when they see that date that says your renewal date is June 30th of 2023, we want them to pause. We don't want them to start that renewal process right away. We want them to exercise that 45-day window before June 30th, before they do any renewal, updating their information or anything like that, because we don't want people to lose coverage any earlier than they need to. This is a 12-month process that will go through 2024. So we want people to look at that date very carefully and the year, because it could say May of 2024, or April of 2024, that they get these letters now. And so if they renew now and their eligibility status has changed, they'll have lost coverage for all the time that they could have maintained their coverages. So Medicaid, Badger Care Plus, and Medicaid renewals, the challenge. What is happening now is approximately 1.6 million people are enrolled in Medicaid across the state of Wisconsin. What we know is that pre-pandemic, there were about 1.2 million. So since then, we've acquired over 400,000 folks across the state, with a large amount of that population coming directly from Milwaukee County. So everyone will need to renew over the next 12 to 14 months. And they can contact the income maintenance or consortiums in their local areas, or here in Milwaukee, it would be the Milwaukee Enrollment Network Services. However, they're going to have some challenges getting through. So what we are asking folks to do is go on to access.gov, the online avenue that they have, and create an account, and then do the renewal through that account and or through the My Access application on their smartphones. And the people who are no longer eligible, well, we have a Robert Wood Johnson Foundation study that says, again, here in Wisconsin, over 300,000 members are going to lose their Medicaid. They're going to lose it because these are folks that were enrolled during the times that they were either losing their jobs, they went down to part-time status, and they became eligible for Badger Care health insurance coverage. Now these folks are going to have to look into their employer-sponsored coverages, look at healthcare.gov, or if they became 65 during this three-year period, they're going to have to enroll straight away into Medicare coverages. And I'm going to give you further information on that too as we go through this presentation. And if they're not eligible for anything regarding the employer-sponsored coverage or healthcare.gov or Medicare, then we also have the federally qualified health centers and free clinics. And the way they can find that information is they can call 211 or go to wiscovered.com. DHS is asking members to take some action steps. And these are some of the action steps that we really need for folks to do so that they can receive their letters of notification of when their renewal dates are in a timely manner. So what they need to do and what we need you to help us with the clients that you serve is to make sure that they have updated their contact information, their addresses, their emails, their phone numbers, because again, people's circumstances have changed over the last 3 years and or they have moved to different locations and not updated that information. So we just want to make sure that they are getting that information in a timely manner, that they're watching for that letter, and that they renew only within that 45-day window of renewing, not before. So just to help some of the clients out, the recommended action steps are going to be, and this is the quickest way for them to upload documentation that is required from their renewals or redeterminations, the My Access app. And in order to do that, they are going to need to have their case number, the Forward Health Card number, and or their Quest Card number. And they can sign up to get the push notifications, update their contact information, as well as get their renewal dates on the My Access app. We are really pushing the My Access app because of the call volumes that will be coming through the consortiums. And to assisters throughout the state, the information that is uploaded on the Access app, they can't renew, but they can upload those documents. That information is received to the Department of Health Services or to the consortiums in their area in less than 20 minutes. So their application can begin to be processed at that time. So I wanted to share with you the My Access app. If you're not familiar with it, on this app, consumers can use this to check their renewal dates, update their contact information, get reminders when it's time to take action, take photos of their documentation and upload it straight away. So the My Access app will look like this on their phones. And if you're assisting folks that have uploaded the Access app, in order to help them find where that renewal date is they're going to check their benefits, and they are going to be able to check their enrollment status, their renewal dates, and especially check the year. And they're going to wait to renew. I can't stress enough, and I will be stressing throughout, that when someone contacts you or says, oh, I got this letter from the Department of Health Services and I got to renew by such a date, you know, you're going to want them to pause, just pause, and not do anything earlier than the date that they are scheduled for their renewals. Probably the first time we ever tell anybody to just pause, stop, don't do anything yet. And if you're helping and assisting folks through the online process, which is access.gov, after they have created that account on access.gov, they will be able to go directly and see everything relative to their case, and their renewal dates, and that they should only be renewing the medical part of their case at this time. Covering Wisconsin, in order to help our partners and local agencies that help people through this process, has created a how-to sheet for consumers. And this how-to sheet was consumer tested, and it's available now in English and in Spanish. And it's a step-by-step instruction on just how to renew your benefits. And this is available to everyone on this call to order through Covering Wisconsin. Also, through this unwind period, folks are eligible for a special enrollment period if they lose their Medicaid coverage between March 31st of this year through July 31st of next year, 2024. So what this special enrollment period for unwinding does for folks is they can attest if they've lost their Medicaid, and they don't need to submit any verification proving that they've lost their Medicaid. The special enrollment period is 60 days after they have lost their coverage. And to avoid any coverage gaps, this is what we are suggesting that people do. That is after they have checked to see if they are eligible for any employer-based coverage, if that's offered to them at their jobs. And many folks are employed in places that still are not offering employer-based health coverage. So they will have this special enrollment period. So if you get someone contacting you, they don't have to fear, they don't have to be worried that they have to have a gap in coverage, because they do have that special enrollment period that they can apply for health coverage through healthcare.gov. And these are just some of the ways that they know that they are eligible for a special enrollment period. And that could be that they've moved from one state to another. They have gotten their citizenship, had a new baby or an adoption. And this is information for you to know that you can get from Covering Wisconsin in English and or Spanish as well, to share with clients that you serve. The health insurance marketplace, normally, again, open enrollment is November 1st through January 15th. However, during this special enrollment period, the circumstances are different, and they are eligible for the special enrollment period through July 31st of 2024. And just a little more information about what you can know for clients that you have served that they turned 65 during this public health emergency passed. They can enroll now in Medicare through a special enrollment period. Now, covering Wisconsin, we don't specialize in enrolling, helping folks enroll in Medicare coverage, but we can supply information to help people prepare for enrolling in Medicare. But we suggest is that you are referring folks to the local ADRC or the Medigap helpline, and they will have this special enrollment period for 6 months after they have lost the coverage. But the sooner they do it, the better. Okay, that is for those clients that you have that have turned 65 during this time period. Health insurance from a job, if the clients have lost their Medicaid and they do have employer-based insurance coverage available to them. Typically, it used to be a 30-day special enrollment period. Now, because these are Medicaid beneficiaries that are losing their coverage through Medicaid, there's a 60-day window. And these are special rules for Medicaid, folks that are losing Medicaid only, that they have that 60-day window, and employers have to allow the employee to enroll within 60 days because there's a HIPAA requirement that says that they have to. And one way that people can determine if their health insurance, employer-based health insurance is too expensive for them is Covering Wisconsin can supply you with this calculator here to determine the affordability if it's too expensive for the single employee or for their families. And that way, if it is, they can enroll into healthcare.gov. But they should check this first. If they have employer-based insurance coverage and if it's affordable. Now we're just going to talk about making referrals and some support tools for members on this call. Covering Wisconsin does have screening tools through it's called our connector tool. And folks can go on Covering Wisconsin's site and find out if they're eligible for Medicaid, or what is the best option for a coverage for them moving forward. So they're not out there alone. There are resources to help them through this renewal process and or having lost coverage because of their income ineligibility for Badger Care Plus moving forward after their renewal. For those of you that have clients that they're worried about their immigration status being a barrier for them acquiring health insurance, they can you can refer them to the Wisconsin Collaboration on Immigrants and Public Benefits, and they can do that confidentially through either over the phone, the WhatsApp, or they can web chat online with this particular platform for assisting immigrants that are concerned with public charge. And then finally, I want to talk about what's going on, what's happening through times like this. People tend to take advantage of those that are vulnerable to fears for losing their health insurance coverage. They don't know what the next steps are, and we've already seen it here in Wisconsin, along with reports out of Illinois where there are some bad actors out there, knowing that this unwind period is going on now. So they are texting consumers and they're saying, you know, we can help you get health insurance coverage. And then they're asking for a fee. Anybody that's doing this work, it is free. All of this work is free to help people find and keep their health insurance coverage. No one should be paying for anything. So if somebody reports to you that someone reached out to them via text or phone call, and this is what they said, please report that to Covering Wisconsin. And we're reporting that to OCI and or the Wisconsin Department of Agriculture, Trade, and Consumer Protection of these bad actors out there. Unfortunately, people are going to try to take advantage of folks that are in the situation of losing their health insurance coverages. Free outreach and educational materials for anybody on this call. Covering Wisconsin does have and will supply to your organizations for free the Unwinding Partner Toolkit. You could go into DHS, this toolkit, and or Covering Wisconsin's, and get information to share with your clients and your partners in your area there, and the information about updating the contact information. This is relevant material that's going to be utilized for the next 12 to 14 months until we get through this unwind statewide. We also have newer materials relative to the unwind and renewing, where they can get help through Covering Wisconsin or local sister organizations. And now also MCN, the Milwaukee Enrollment Network, and OCI does have a toolkit with unwind materials on it as well that you can get information from to share. Covering Wisconsin, we do offer the educational resources for whatever county you're in that will give them information on where they can go for questions related to SSI or Badgecare or Medicare or anywhere. And our health insurance options sheet is there to help guide folks through if they're not eligible for Medicare, they're not age eligible for Medicare, or they're not eligible for Badgecare. What's the next step? Where can they go? There are options, always options out there to help people have access to care. And then we are asking, Covering Wisconsin, as well as the Wisconsin Office of Commissioner of Insurance and DHS and healthcare.gov, send out regular Facebook and Twitter ads about the unwind. So we're asking that, you know, you share or repost some of the information with your communities as well, to help spread the word and get this information out to people in your communities, to help them stay alert and aware of actions to take during this unwind. And then also I wanted to mention that we do have, for anyone on this group that, or your partner organizations throughout the state that want to receive additional information, stay abreast of policy and changes and actions throughout this unwind period. We do have Milwaukee, we do have enrollment networks, throughout the state that you can join. And they are located in the Northwest, Western, Central, Northeast, East Central, Milwaukee, and Southwest and Southeast regions of the state of Wisconsin. We also have a Latino enrollment network that if you want specific to the Hispanic community, you can enroll in that network, and you'll get a wealth of information. Many different organizations are part of these enrollment networks, and they share information across the board, you know, on what they're doing to assist people with insurance options, questions, and navigating this unwind period of Medicaid, Badger Care plus health insurance coverages. Some key messages, again, for Badger Care and Medicaid members, they have to renew. They need to keep their contact information updated. And if it's not been updated, they need to do that now, so that they are receiving the information that has been going out and is still going out on a monthly basis to consumers across the state that have that coverage, and that they should know their date and then wait, pause again, only renew 45 days of their renewal date. And if they have questions, that they should either call 211 or to find an enrollment assistor to help them navigate this process, or visit what'scovered.com. And we are here to help. Covering Wisconsin can be found at our website, uncoveringwisconsin.org. You can call us in Madison or Milwaukee, and you can go online on our website and chat your questions. We have the new chat bot features where you're speaking in real time live with a navigator, and schedule an appointment to have in-person assistance if that is what the clients want, through our connector tool. And that is it. And I thank you so much for your time. And I am open to any questions.
I think we're bumping right up against 5 p.m. We do have 1 minute if there are any questions. I think people asked if you'd be willing to share the slides, and you did already.
Absolutely.
So no questions in the chat box. I would just want to thank you very much to you, Cheryl, and to all of our presenters today, and for all the people in the task force who came and see the presentations. We'll have our next meeting in May, second week of May, and we'll have, I believe, some topics relative to the May mental health issues, children's mental health and things of that sort. So thank you very much, and see you in a month.
Yeah.
Thank you.
Cheryl, great resources.
Bye.
Thank you so much.
Thank you.
You're very welcome. Bye-bye now.
Have a great day, all.
Have a good day.
Good day,
Bye.
everyone.